रिजवान भाई आप स्टार्ट कर
हाँ,
सकते हैं।
जस्ट मिनट। So, am I audible? Please confirm.
यस।
Yes. Okay. So, good evening, everyone. A warm welcome to this special webinar organized by Lung Connect India Foundation as a part of Lung Cancer Awareness Month. So, our discussion today, Know Your Rights During the Lung Cancer Journey, focuses on a subject that goes far beyond uh, medicine, right? It's about awareness, empowerment, and dignity. So every lung cancer journey is unique, but one things remain constant. That is the importance of knowing your right, the right to information, to timely and equitable treatment, to emotional and social support, and to making informed choices. So I'm honored to moderate this session with an inspiring and diverse panel representing every perspective from a policy and clinical care to global advocacy, lived experience, and caregiver. So let me make a moment to introduce our distinguished panelists. So I'm going to introduce Ms. Aparna Mittal. She is a founder of Patient Engage and a patient advocate. Welcome, ma'am, and thank you so much. Our next panelist is Mr. Rishi Maheshwari. He is a patient advocate and a lung cancer patient from Mumbai, whose courage and positivity continue to inspire us. Welcome, Rishi. Our next panelist is Ms. Shampa Ghosh, a patient advocate and a young lung cancer patient from West Bengal, whose resilience continue to inspire many. Welcome, Shampa. Our next panelist is a caregiver. I'm talking about Dr. Tanya Lal. She is a patient advocate and a caregiver from Dehradun, who has stood strong beside their loved one through treatment. Welcome, Dr. Tanya. Our next panelist is Mr. Prabhat Sinha, who is Director, Government and Public Affairs at Boehringer Ingelheim. Welcome, Mr. Prabhat Sinha. Our next panelist is Dr. Amit Kumar, who is a Senior Medical Oncologist at Medanta Hospital, Patna. So, welcome, Dr. Amit.
Yeah, thank you.
I think there are few more panelists who are yet to join. So, we are going to start our panel discussion. So, my name is Mohammad Rizwan. I'm also a caregiver. So, I would like to extend my sincere gratitude to each of our panelists for, taking the time to be part of this webinar. So, together we will explore how awareness of patient rights can truly transform care, not just in hospital, but also across system, communities, and heart. So, let's begin our panel discussion. So my first question with Ms. Aparna Mittal, ma'am.
Yeah, hi.
Yes. So my question is that as a founder of an online healthcare platform that support patient and caregiver holistically, my question, in your opinion, why it is important for patient and their families to know their right?
So thank you for inviting me to this session to Lung Connect. I think I'll start a little bit more kind of, from the perspective of the Universal Declaration of Human Rights, right, which emphasizes fundamental dignity and equality of all human beings. And based on that, we do have a Charter of Patient Rights in India, which has been created by the National Human Rights Commission. But it focuses on a list of specific rights, right? Like right to patient education, right to records and reports, right to informed consent, right to protection in a clinical trial, and so on. However, my understanding is that this is narrower than the right to health, which is a broad and overarching human right. And that broad and overarching actually asks us to the right to health should be the highest attainable standard of physical and mental health. And I think that is something that we really need to focus on, because then that is that is indivisible from other human rights, like the right to education, right to participation and shared decision making. All the underlying determinants of health, like food, housing, work, and information, right? And it includes four essential elements. So, you're looking at it from the perspective of availability, which is capacity. You're looking at it from the perspective of accessibility, which means, physical accessibility, economic accessibility, which is affordability, information accessibility, as well as a non-discrimination. And then you have acceptability, which deals with ethics and being culturally appropriate and sensitive to the needs of the various diverse population groups. And finally, you need to address to make sure that the quality is consistent across all of these, not just the health facilities and products, but also the underlying determinants of health. For example, safe and potable water, air quality, sanitation, etc. Right? And as we stand today, we don't have a focus on right to health in the Indian Constitution. So that's something I think as a society, as a patient body, we do need to advocate for right to health, which is more holistic and more comprehensive than the Charter of Patient Rights. And I'll explain that in example, right? While the chart, for example, simplistically, if you look at it, the Charter of Patient Rights protects a patient during a clinical trial, but it does not encourage availability or access to a trial, right? So those are two elements. So, it's important to distinguish the two to understand where it is. Similarly, there is a right to choose the source for obtaining medicines and tests. So you don't have to, you should have the option of going to any supplier and get your medication. Which is a good right, but it's not the same as a right to health, which would promote affordable access to the best possible healthcare, and not just in terms of medicines and doctors, but and testing, but across the entire, not just during the treatment phase, but across the entire lifetime of a patient journey and survivorship. And it should be irrespective of where the patient lives and what socioeconomic strata he comes from. And that healthcare should be in concordance and agreement with the values of the patient, which is what we mean by shared decision making. They should not need to travel 200 kilometers to access care, right? So when I say healthcare, and all of us, and that's what you also implied, Rizwan, is that you need to look at the entire healthcare ecosystem, not just the medical system, because as I keep saying that more than 90% of care happens outside the clinical arena. And we need to look at the underlying determinants of health, access to all of them, whether it's food, whether it's clean air, whether it's water, whether it's the ability to work and be supported in a work environment, the right to information in a language the patient understands so that they can participate in shared decision making. And all of these mean that we really, as patients and patient advocates, need to advocate for right to health.
Great, great. Thank you. Thank you so much. You rightly discuss about, mental health. You talk about accessibility, affordability of the medicine. Yes, as a patient or as a caregiver, we know we do have medicine, but is it affordable? Is it the one anyone can afford without having, support from insurance and all? You rightly touch about the clinical trials. I believe we do have the data, we do have the website, but whether that data is presented in such a manner that a patient can able to access that data, patient can able to choose and be a part of trial as per their criteria. So that really need to be done. So thank you so much for the for your views. So moving forward, we are having Prabhat Sinha ji. My next question to you, Prabhat ji.
Yes, Rizwan bhai.
Yes. From an industry and policy standpoint, how can pharmaceutical companies contribute to strengthening patient rights and improving access to innovative lung cancer therapies in India?
Thank you, Rizwan bhai. First of all, बहुत thank you, धन्यवाद to invite me for this. I think yearly conversation that happens. It's a very big question, right? I think I'm too small to answer in totality, but I was reading a line, and I always believe on this line: a right delayed is a right denied, right?
Yes.
A right delayed is a right denied. And I think for people living with a terminal disease or disease like lung cancer or any cancer or any disease, this holds true. Because if we are delaying a right, is we are denying that right. And when it comes to access to any therapy, right, this is very important, because if it is not happening, if I am living with a condition, if I am not getting access, then at least for me, it's an end. Maybe somebody in future may get benefit out of it. So this is very important. A right delayed is a right denied. Now, when you asked what pharma company can do, uh, and uh, what they have been doing actually, see, when we see a industry or a pharma company, we feel that typically that their responsibility starts when a drug comes in the market. But actually, uh, the responsibility starts much before, even when the research is in a very initial stage, right? उस समय से जब उस पर्टिकुलर दवाई की रिसर्च शुरू होती है, वहां पर से पेशेंट वॉइस, पेशेंट का इंगेजमेंट, इन्वॉल्वमेंट शुरू हो जाता है। और आज के दिन में अधिकतर कंपनी में जितनी भी इनोवेटिव कंपनीज हैं, वहां पे बहुत इनिशियल स्टेज पे ही जो लिव्ड एक्सपीरियंस है वो वहां पे आता है। क्वालिटी ऑफ लाइफ क्या हो सकता है, क्या आउटकम हो सकता है, क्या एंड पॉइंट उस ट्रायल में ले सकते हैं, इन सारे डिस्कशन में पेशेंट्स वहां पे रहते हैं। और ये साइकिल वहां से शुरू होके फिर जब क्लिनिकल ट्रायल होता है, उस टाइम पे भी पेशेंट्स उसके पार्ट होते हैं। जब ड्रग मार्केट में आ जाता है, देन पेशेंट एक्सेस प्रोग्राम होता है। सो हर जगह पे इन्वॉल्वमेंट जो है वो मरीज का, पेशेंट्स का इंपॉर्टेंट है। लेकिन उस इन्वॉल्वमेंट में, एंड स्पेशली फॉर एग्जांपल क्लिनिकल ट्रायल में, जब वो उस बीइंग पार्ट ऑफ दैट क्लिनिकल राइट ऑफ उस पार्ट ऑफ दैट ट्रायल, उस पेशेंट के भी कुछ राइट्स होते हैं कि भाई अगर मैं इस क्लिनिकल ट्रायल या रिसर्च का पार्ट हूं, ये मेरे राइट्स हैं। बट वो राइट उनको पता कैसे चलेगा, और क्या उनको पता चलता है? एक्सेस टू इंफॉर्मेशन, जैसा अपर्णा जी ने कहा, आपने कहा एक्सेस टू साइट जहां पे क्लिनिकल रिसर्च चल रहे हैं, ये सारे जो इंफॉर्मेशन है, इसको एक्सेस कराने के लिए भी जिम्मेदारी सबकी है। और अगर वो इंडस्ट्री है तो उसकी भी जिम्मेदारी होती है, राइट? तो उस पूरे साइकिल में हर जगह पे रिस्पॉन्सिबिलिटी भी है और रिस्पॉन्सिबिलिटी भी है कि हम कैसे उनको इंगेज करें, इन्वॉल्व करें, और उनको वो राइट जो वो डिजर्व करते हैं उनको दें। अभी क्लिनिकल ट्रायल का वो मरीज पार्ट है, लेकिन उसको क्या वही सारी सुविधा मिलती है क्या? मैंने अपने ही देश में, एंड मैं जो भी बोल रहा हूँ, आई एम स्पीकिंग ऑन माई पर्सनल कैपेसिटी, आई एम नॉट रिप्रेजेंटिंग माई कंपनी, राइट? कि अगर एक मरीज किसी क्लिनिकल ट्रायल के लिए कहीं पे जाता है, तो मैंने देखा है 18-18, 24-24 घंटे वो मरीज जो है वो ट्रेन में, बस में, पब्लिक ट्रांसपोर्ट में धक्के खा के जाता है। लेकिन शायद किसी दूसरे देश में ऐसा नहीं होता होगा। वहां पे आपने डिग्निटी वर्ड यूज किया था शुरू में, है ना? डिग्निटी, कंफर्ट, वो शायद उसका राइट है कि अगर वो वहां पे जाए और अगर अच्छी सुविधा है तो अच्छी सुविधा से जाए, वो फ्लाइट से जाए वहां पे। क्यों वो ट्रेन से जाए? क्योंकि वो क्लिनिकल ट्रायल का पार्ट है। तो जब वो ट्रायल का प्रपोजल बनता है, उस समय पे वो डिग्निटी इंश्योर करना भी कहीं ना कहीं हमारी जिम्मेदारी बनती है, एज अ इंडस्ट्री, एज अ होल, राइट? और मैं इसके बाद रुकूंगा, बट अंबेडकर साहब ने एक और चीज कहा था: एजुकेट, एजिटेट एंड ऑर्गेनाइज, राइट? और एजिटेट एंड ऑर्गेनाइज तभी होगा जब वो एजुकेट होगा। एंड यहाँ पे अगेन इंडस्ट्री का बहुत बड़ा रिस्पॉन्सिबिलिटी है, रोल है, इज टू एजुकेट, एम्पावर पेशेंट्स अक्रॉस द कंट्री, राइट? एंड जैसा लंग कनेक्ट है, या ऐसे बहुत सारे इनिशिएटिव है, पेशेंट इंगेज चलाती है, ऐसे सारे इनिशिएटिव में अगर इंडस्ट्री सपोर्ट नहीं करेगी तो कौन सपोर्ट करेगा, राइट? तो बहुत सारी चीजें करने के लिए लिस्ट बहुत लंबी है, राइट? बट मैं वहीं पे खत्म करूंगा बोल के कि राइट डिलेड इज अ राइट डिनाइड। सो हमारे पास सोचने, विचार करने में जितना टाइम लगता है, उतने टाइम में शायद बहुत सी जिंदगी खराब हो जाती है पहले से, या चली जाती है। सो आई विल स्टॉप हियर, रिजवान साहब।
Okay. Thank you, Prabhat ji. आपने बहुत अच्छे से स्टार्ट किया कि राइट डिले इज राइट डिनाइड. बिल्कुल, I do agree. And you talked about clinical trials. So I still believe in India there is a lot of work need to be done, specifically for the awareness part. Creating awareness to the masses for the participation in the trials, for understanding the pros and cons of the trials, various side effects of the trial. That really need to be enhanced. And thank you so much for your views. Moving forward, we are having Dr. Sevanti Limay, ma'am. So she is the Director of Medical Research, Shri HN Reliance Hospital, Mumbai. Welcome, ma'am, and thank you so much for joining with us.
Thank you. Thank you for having me.
Thank you, ma'am. The question to you is, lung cancer care often involve difficult choices, right? So how do you approach shared decision making so that patient feel respected and heard throughout their journey?
So thank you. Thanks for asking this question, and congratulations, Lung Connect, for having come this far. Kudos to you, and all respect and regard. You're doing a great and wonderful job. And so many congratulations in getting us all together. Having said that, just to answer your question, I think shared decision making is certainly growing in India. It's picking some speed. However, I feel we are still significantly lagging, and that is mainly because of our limited awareness of cancers, of lung cancer, of specific type of malignancy a person has come down with. And so I think the most important and most basic requirement of a clinician is to try and educate the patient. So when the patient comes in, I actually have a whiteboard in my clinic with which I try to, like a teacher, educate the patient about what kind of lung cancer they have. How do I think about lung cancer? What is the mechanism with which the cancer develops? Whether it's a smoker's lung cancer, non-smoker's lung cancer, what is the driving force? And after having explained things, then talking to them about what kind of tests I'm recommending and what kind of therapy, what does it involve, and whether they should be looking at paying for things out of pocket, or whether some kind of insurance will cover, whether there are clinical trial options. All of those with great detail and diligent discussion, one is able to bring them up to speed in some ways. Having said that, I still feel there's much more needed in terms of creating awareness, and especially in lung cancer field, I feel the awareness regarding testing to understand which type of lung cancer the person has, not just histopathology, but genomic analysis is integral to spreading the message and shared decision making. So it's not just clinical care, but starting from diagnosis, nuanced testing to therapeutics, and of course, clinical trial participation. That entire thing is dependent on shared decision making. And for shared decision making, you need to bring the patient and the family up to speed with where they are, what is the story, and how to go about understanding what they have and what treatment they need. So I think that interaction, especially the initial interaction with the patient and the family, is most critical in setting the stage for the patient to understand what's their diagnosis and treatment going to entail. So, of course, it's full of challenges, but
Right.
I think we are getting there.
Correct. Thank you. Please stay with us. I will come back to you, ma'am. I know
Sure,
you are traveling, but please stay with us. And thank you so much
surely.
sharing your, complete procedure, complete activity which you perform to a newly diagnosed patient, and it really help us. It really help the patient to take the holistic decision, to understand the disease and take the decisions. So thank you so much. Now it's time to listen our patients and patient advocates. So my next question with Mr. Rishi Maheshwari. Rishi,
Hi.
yeah.
Yes,
So,
thank you. Am
so
I audible?
yes, you are audible.
Thank
Okay,
you very
so
much.
the question is, you have just listened to our panelists speak about the right of patient during their, treatment journey. So, based on your own experience as a patient, how could you share how your journey aligned with these rights?
Sure. I just take a minute to explain what my journey was so that we are on speed with this.
Sure.
Thanks for giving me this opportunity to Lung Connect. My name is Rishi Maheshwari. I'm 44 years old and I live in Mumbai. It's been 5 years since I've been diagnosed with lung cancer. In 2020, when most of the world was actually fearing the C word, COVID, it was actually that was the least of my worry because at that point in time, I had been diagnosed with another C cancer. My initial diagnosis was cancer of an unknown origin, and the tumor was restricted to my hamstring. So, a renowned surgeon operated, and I felt the disease was past me. It's only 2 months later that I figured out that it's actually relapsed, and when it relapsed, it was a metastatic non-small cell lung cancer is what I remember, which means that it would have spread to several of my organs, including the hamstring, shoulder, and most prominently in both my lungs. So I was told by most prominent doctors in Mumbai that there's hardly any time left, given the spread of the disease. Maybe about 6 months to a year is what I think is what they would perhaps give me the best opportunity. In the second stage, since then I've undergone treatment. I was in the right hands with most of what was spoken about the rights. I've had a privilege to have most of it. Um, the second part was when my father was diagnosed with glioma about a year and a half ago, and then we fought with that as well. So I am over the last 4 or 5 years, I've had three separate incidents of having gone through this disease, and now I think I as a caregiver and a patient, I'm thankful for the panelists for the detailed understanding over this because I'd like to take you through the patient's perspective over here. Um, for the patient, the fight is actually a fork fight. It is a three-pronged fight, in my view. The first fight is actually, and the most foremost fight is actually that of knowing about which doctor to consult. Imagine a family who's struck with this disease who actually have no knowledge of it. They go helter skelter asking anybody and everybody about where to go, who to reach out to. I think that essentially is the biggest right one should have, to be able to know that a person who would have thought of his life as 70 to 80 years, and the doctor tells him, or anybody else tells him, that from 70 to 80 years you are left with 70 to 80 days. Who to reach out to in this case? Which doctor to reach out to? What kind of tests should I do? How many doctors should I reach out to? It's practically impossible for a patient and a caregiver, once you have been admitted to a doctor, to be able to decode everything. I think Dr. Lemay gave a very succinct example of that she takes a whiteboard and explains everything. Most of the other hospitals are challenged with some form of infrastructure, and it is not essentially possible for them, given the number of patients who are waiting outside. And that is how I've experienced. We generally get about 10 minutes, at best 15 minutes. Within those 10 to 15 minutes, I have to understand, decode, and be able to figure out what possible recourse should I take, because at the end of it, the doctors sometimes, if it has multiple choices, sometimes the doctors give you multiple therapies. For instance, a chemo, radiation, a mix of both, immunotherapy, targeted therapy, and then there are plethora of words that comes across. So once you Google them and come back to the doctor says that the Google is not the right friend. So you kind of get a little more perplexed about how to go about this. That's the first right that I believe one should have, is the right to information. You very succinctly mentioned it. The second is actually the fight with the dwindling bank balance. I had taken a very expensive test of NGS, in my view, expensive because at that point in time, affordability could have been slight bit of an issue. Where PDL1 was shown as 0. It essentially means that I perhaps expensive things like immunotherapy, which possibly could have cured me, still not an option. So most doctors would, and doctors themselves and well-wishers would say that this is prohibitively costly. So hence, let's not go for this. Thankfully, my treating doctor insisted that you should go for it. It has been a life-saving therapy. I told you that I've been through a 4th stage cancer, and thankfully, it's been good. I think I record that to the medicine that I took, but the medicine is extremely expensive. I did not know until the 3rd round of medicine that the company that makes it actually runs a program which sells one vial free for another vial. So I did not have a clue about it. I think that is my right to know. I had a scenario. The third part was to fight with the insurance companies about this. One paper not written well. I had to go back to the doctor, stand in queue for about 4 or 5 hours to get that paper written, go back to the insurance company, give them the document, and then they'll come back with another query for which I'll have to go back again. This fourth come back and forth would happen several times, to the extent that I've reached out to the ombudsman. Ombudsman which says that I have plethora of cases with me. Your case will take about 4 months to get resolved. And then I'm fighting with the ombudsman with letters after letters. So you are fighting your own battle with cancer, and you're fighting with the insurance company to plead for premiums that you've paid to be able to get it. The third and the most important part is the emotional need. Your caregiver and all people around you would give you enough comfort that things will be okay, don't worry about it. But you know that they only have as much prayers for you as much as they know about it. They do not know much about it. Hence, I think there is a forum that should be my right to of collective people. Lung Connect has done a wonderful job on that. But one will not tend to know about Lung Connect right away. Until about a couple of years, I did not know. I've been fighting with the same disease for the last 5 years. So there should be a collective forum, or a right to have a forum which will have co-patients who will tell you their journey, their victories. You will get to know about how to overcome those challenges. Should we have the right to seek help from fellow patients? That I essentially think is the third right. And that's why I said these 3 4 points that I consider as most important as a patient when I go through the disease. Thanks. I'll take a break before you have another question.
Yeah, thank you. Thank you, Rishi. I think the moment you start narrating your story, it seems like you are narrating our story. Because as a caregiver, when this disease got diagnosis, exactly the same dilemma that you are having, all are having the same dilemma. And you rightly mentioned about the various aspect of the rights, like the insurance you talked about. Most of the patient, they call us, and they are stuck with the different terms and condition of insurance, and they are they are not able, didn't get confidence that they will get insurance money back after the treatment. Insurance ombudsman you talked about, we also don't know about ombudsman itself. During one of our patient itself told us about ombudsman, and we conducted a session with them. You talked about the journey of the fellow patient and caregiver. So I'm happy to share that the Lung Connect India Foundation has started a buddy program in which we are, just matching the new patient with the, having some experience. The two patient, we match up them, and they share their journey, the common issues. So that is the thing. So thank you, Rishi, for sharing your experience and highlighting what are the rights that need to be fulfilled. So thank you.
Appreciated.
Moving towards Dr. Amit Kumar. Yes, Dr. Amit sir.
Yeah.
So my question to you, sir, what do you believe can be done to make second opinion and multidisciplinary consultation more accessible to patient, and especially in smaller cities, sir?
So it's the most important thing. So what is happening in India is still like me. I'm practicing in a private setup. Also goes to Tata once in a week. But we are practicing everything. So our approach is holistic. So right from head neck cancer to lung, breast. So we are practicing anything. But it is the time of precision coming up, and we see that for a lung cancer, there is a separate. If there is a separate doctor, he's only looking at lungs. So this thing happens in India and only at TMH, I'll say that there is only that center which has got a DMG wise system is there, mostly, and a few other hospitals are there. So the important thing is the patient, first we have to counsel the patient, let them know about their disease. Few patients in the smaller cities says that they want a second opinion, and so, but if there is any time any doubt about the diagnosis, about the treatment, in that case definitely second opinion, I'll say, is always a right of the patient, because I always counsel the patient that this is your life, you have the right to know everything about your disease and also about the treatment, and you should not only depend on a single doctor on your treatment, you should discuss with other doctors also, take the opinion from many people, and then you have to decide where you want to get your treatment from. So the challenges mainly happens is the transport. I'll say that if the patient wants to go to Delhi or Bombay from, I'm practicing in Patna, so sometimes patients say, so where to go, how to go. So the important thing that I navigate them. So navigation is one of the important things. So one have to let them know where you have to go if you want to have something specialized and to get that. So in that case, so we send the patient exactly to the exact doctor who is only practicing that part, and let them know कि ठीक है आप उन्हीं डॉक्टर से जाके मिलिए. If possible, we give them a call and send them. The other things are important कि once second opinion is being planned, few things, basic things has to be done. That the patient, if they are going, so the initial, all the tests is basically done in our setup, everything we are able to do it. So once we send the patient, we ensure that the patient is going with their, if their imaging has been done, so they have to go with their CD, CT scan or PET scan CD. Sometimes it also happens that in our setup, we have got a direct link with other specialist in Delhi or Bombay. So we just transfer them, the CD or the MRI or the PET CT. It can be transferred on tele consultation forum. And the other thing is the biopsy. So we ask them to take the biopsy block along with them, because these two are the things that is the most important, that helps in the diagnosing and staging of the disease. And once the patient goes there, takes a second opinion, then the patient has to decide what does they want. Sometimes it happens. So in our case, the second opinion is mostly regarding the surgical part, because surgeons are still concentrated in metros, especially for if there's a high risk surgery involved. So in those cases, we ask the patient if they want to get operated there, get it operated. And since after that, the therapy, either radiation or chemo, it takes a long period of time. In that case, they come back to their own local place and then go with the treatment. And the important thing is we ask them to be in consult with their primary physicians. If say if somebody is being treated at Delhi or Bombay, to visit them at least once in 3 months or 4 months, so that it's easier for them, and at least 2 or 3 people are guiding the patient. So it's their one life and nobody is making a mistake. And if somebody misses something, other people knows that. So I think so the patient has to be educated about this, about their disease, and then we second opinion always is the right of the patient and one should take. So I never ask any patient that what I am saying is always right. You have to, if you want, take the second opinion, and then we will again rediscuss what do you want.
Yes, thank you, Dr. Amit. Thank you so much. What happened when new patients try to contact us and they talked about second opinion, that whether I should ask our oncologist about, I want to take second opinion. They really hesitate, because in normal medical practice, apart from oncologist, they cannot ask with their doctor that I want to take second opinion for other disease they are being treated. So they feel that what kind of response our treating doctor will give, they are really confused. So it is very much important that oncologists should also, discuss that. Yes, it is very, you are okay and you can take second opinion.
You should be very much compassionate about that, and it should never be taken on the ego, even on the part of the doctor, I will say. So even I'll see if the patient progresses on the first line. So I've seen many patient, Dr. Semanti is practicing the precision medicine. So she is doing everything of the precision type. So I send the patient, go and take an opinion, get an NGS done from a specialized center, because NGS is being done all over, but it is not of the same quality. So get it done. For any head and neck cancer or a brain tumor, so Dr. Vijay Patil is practicing solid tumors. So I know who are the best person in the country who are practicing the specialized part. So I usually used to say, ask the patient, go and take a second opinion from them, and then we will discuss whether the treatment is feasible. If it's feasible, it's okay. You can take that treatment from there. If it's not feasible, then we'll continue with the treatment which we are practicing. And even if a treatment is planned there, we continue it here because we are good at managing all the toxicities which the patient may be having. So never to take it on the ego, even on the part of the doctor, I will say. And it's because the patient has only one life, one cannot take any chance in that. So somebody if is doing something specialized in a particular field, we should generally discuss with this. So I'll say from my part, even I get a common cancer also, which we know we has a common treatment, but we say in the next 2 to 3 years, things has evolved. So before planning the treatment, I used to discuss. So we have got a very good, I'll say, community doctors, oncology community also. We discuss on that community and then plan a treatment for the patient so that we are not making any, losing anything or not forgetting anything for the treatment part.
Yes. Thank you. Thank you so much, Dr. Amit.
Yeah.
Now moving to a caregiver, Dr. Tanya Lal. Dr. Tanya, kindly unmute.
Yes, sir.
Yeah. So my question to you, as a caregiver, what rights or area of support do you feel caregiver themselves often miss or overlook while focusing on the patient? So what is your take on that? What is your opinion?
Yeah, so first of all, once again, thank you so much for having me. And I've been listening to all the panelists, and I agree with so many of them on certain points that while they were speaking, I was just trying to, I was recalling my journey with my mother. So, yeah. First of all, I think for the physical needs have to be taken care. By physical, what do I mean is we should not be afraid to ask for help. Because sometimes, especially when the disease is diagnosed, we feel no, we are there. Only one person will take care, and out of love, maybe we want no, we will be there for for a patient. But what happens in due course of time is even we get that burnout, so that has to be planned. So in my case, me and my brother, we have strategically planned, and still I feel two hands are less hands. And I've been very privileged to have a big joint family, and multiple ways we get some sort of support, whether it is physical, mental, spiritual. And another thing I felt as a caregiver was like, when we go to the doctor, we are prescribed a treatment, we follow that religiously, but I feel more than that, the patient is spending time at home or with their loved ones. So there, the problems that we face is even in some sort of, sometimes some medicines needs certain recalculative doses, or sometimes there are new symptoms. So many a times I was not able to contact my initial the main doctor. So we rely on the doctors who are there in our locality, and I feel, again, I've been privileged that we have access to people, whether they are doctors or whether they are their secretaries, or who are available. So availability, even though at any time of the day, at any time of the hour, to any sort of medical issue, was one of my biggest concern, because I am located in a different area, my mother is in a different area, and she has been diagnosed with a very rare variant of lung cancer. Then I did not hesitate to ask for as much opinions as I wanted, because being given that it was such a rare variant, like Amit sir said, I did a lot of teleconsultations, because I myself wanted to understand what has happened to her. Because from a simple pneumonia, when the biopsy result came, we were also very shocked that such a type of lung cancer, when she has no history, we couldn't trace anything, any etiological factor, nothing we could trace. So all we were left with was with a big question mark as to how to go about it. So I remember those initial months were very, very, in anxiety, and we just did not know what to do. And me, myself, being in such a profession, I too had to face difficulties. But again, we were lucky, we were privileged that we could connect the dots. And also, I would like to thank Lung Connect, the platform. Now I know if somebody asks me a question, I know where to send the person to. because A, the treatment part is totally on the doctor, but B, as a caregivers, we will try to share whatever information that we have or we have faced with others so that they do not face the difficulties that we have had. So I was planning to discuss with Sanjeev ji and Rizwan ji with you that maybe in Lung Connect also we can have certain sectorial sort of teams, like somebody who can help or guide with insurance, somebody who can help and guide with the mental, mental needs,
Well-being. Right,
emotional
right.
needs. Somebody who can guide with, say, for example, the different schemes, the financial supports. Like for medicine, we got to know that there was a scheme and we had readily enrolled in that scheme. That was all because we knew that such a thing exists. But also, one area that I feel could maybe, I don't know how to solve that thing is how to understand what are the various uh, developments or research or updates that are being that is happening with that disease. So being myself a researcher, my mindset is to understand and to read the diseases from proper sources, not from Wikipedia, not from Google, and not from social media. So but then same thing, like with my other relatives who are not into this medicine field, so I feel they hesitate. So I tell them, you should feel free. Asking a question will not do any harm. Suppose if we are being giving a radiation prescription and the radiation cost is also very skyrocketing. So affordability is fine, but then why not ask
Right.
freely? Is there anything that we can avail on this? So that started happening with my brother or with others, at a very later date. So I feel we should not be afraid to ask questions. And again, the part that I think Prabhaji mentioned, right delayed is right denied. I so felt that statement because it was not with us, but it was with patients who we encountered. Again, when it came to the disease, because I wanted my mother to get the best of the best which is there in the country, and I also I went beyond, and I was emailing hundreds of institutes. I got in touch with the institutes which were in UK, US, and a very surprising response happened that they responded me sooner than the with the people who were there locally. So again, the same thing. Even Aparna ji also mentioned right to health. So that I feel is something which could be worked upon, and even as layman, how to explain the layman.
Yeah,
Yeah,
kindly wind
these
up.
are the
Yes, yes. Okay, we have.
yeah, like these are the advancements, and how to, I mean, that's a challenge which I feel can be worked upon. And same with the health insurance companies, because until unless you are hit with that big disease, you don't know whether that is covered or not. So
Right.
why aren't the health insurance companies, they should be more open and vocal about this covers XYZ disease or whatever. वो छोटा सा asterisk mark देके लिखा हुआ रहता है, this is
Correct,
not
correct.
covered. Then we realize, oh, we missed, because we
Miss
don't
correct.
know. So yeah.
Thank you. Thank you. Thank you so much for such a elaborative way you make us understand what are the rights that need to be addressed. So thank you. Thank you, Dr. Tania. So moving next, Shampa Ghosh. So, your question is, how did knowing your rights as a patient help you to take? या सो सवाल ये है कि आपके लिए आपके अधिकारों के बारे में जानना कितना जरूरी था और इससे आपके इलाज के सफर में क्या फर्क पड़ा?
देखिए, मेरा अधिकार जो है वो जानना जरूरी है, क्योंकि मुझे लगता है मेरा एक्सपीरियंस थोड़ा इतना ज्यादा नहीं है, क्योंकि मैं अभी 4 महीने हुए हैं, मैं जान चुकी हूँ कि मेरा कैंसर है। तो मुझे लगता है कि मेरा डिजीज जो है वो मुझे पता होना चाहिए, क्योंकि मैं ही पेशेंट हूँ और मुझे ही इनका मुकाबला करना होगा। और एक बात है कि डॉक्टर जो है ना, वो उसको थोड़ा फ्रेंडली होना चाहिए, ताकि मैं मेरा सब जो सवाल है उनसे फ्रेंडली मैं बोल सकूं, फ्रीली बोल सकूं, सब कुछ क्या है, क्या ये डिजीज क्या है, इनका ट्रीटमेंट क्या है, ये सब मुझे जानना जरूरी है, क्योंकि मेरा ट्रीटमेंट मुझे ट्रीटमेंट लेना पड़ेगा। और एक केमो है क्या, दवाई है या रेडिएशन है, वो सब क्या होता है, सब पता होना जरूरी है। मुझे ऐसा लगता है। और ये सब जो डिजीज है, वो मेरे लाइफ में बहुत इफेक्ट है, फैला है, क्योंकि मेरे एजुकेशन में, क्योंकि मेरा जो दवाई है वो जब लेना पड़ेगा तब 1.5 महीने के बाद आना पड़ता है। तो मुझे जब मेरा एजुकेशन में बहुत मेरा तकलीफ हो रहा है कि मानो कि मेरा एग्जाम आ गया और मुझे जाना पड़ेगा, तो फिर मैं क्या करूँ, मेरा एग्जाम नहीं हो पाएगा। तो ऐसे ऐसे है। और फिनेंशियल जो है वो भी बहुत मायने रखते हैं फैमिली में, फैमिली इनकम में जो है, वो मुझे लगता है कि ये सब सारी चीज जो है ना, डॉक्टर को बताना होगा, और डॉक्टर ही कोई हाल जो है वो हम लोगों को बताएंगे, ऐसा लगता है।
थैंक यू, थैंक यू। बहुत अच्छे से आपने अपनी बात को रखा, शंपा। थैंक यू। एंड आप सबका, सो मूविंग टू आवर नेक्स्ट पैनलिस्ट, as we have very limited time, so I request every panelist to kindly give their opinion in short. So my next question is Ms. Aparna Mittal. Ma'am, my question is to how important it is to integrate, psychological and emotional support into a medical treatment as a part of patient's right to comprehensive care.
Thank you, Rizwanji. We know that cancer journey is a very long and difficult journey, right? We've heard patients and caregivers, even on this panel, talk about it. It's life-threatening, it's emotionally draining and overwhelming. And while they're still struggling with the why me question, then you have the uncertainty of being able to find and afford the right treatment option. And there's the financial toxicity that can come with it. You have to travel long distances, as we've just been hearing, and it causes families to fragment, right, between home and treatment location. And in our experience of speaking with thousands of patients, we find that there's definitely a need to provide better supportive care as well as a supportive environment. And in terms of the environment, I mean, the family setting, the social setting like school and workplace, and the community at large, because that plays directly into the ability of a patient and their family to be able to navigate this journey, right? And in terms of supportive care, beyond psychosocial care, you also need nutrition, you need rehabilitation as well. And there is this strong perception whenever you talk of mental health, there is this perception that if you tell somebody be strong and positive, they'll turn on one switch and it will become strong and positive, right? And while we understand the importance of being strong and positive, and that it does make it better in terms of outcomes, but it also, you need to look at what is the causation, the underlying factors that impact that, the emotional and psychosocial well-being. So for instance, if the distress is due to fear of job loss, we need better provisions for employees in organizations. If the fear is about missing exams, then we need to figure out how we are going to create environments for patients while they're navigating this to deal with that. Financial toxicity, which is, I think, a common factor for pretty much everybody going through treatment in India. We need to again advocate for better coverage in our universal healthcare schemes or our insurance packages, right? And ultimately, I think also I think we've had, like Rish talked about, challenges of not knowing, not finding a patient to talk to, etc. So we really need to leverage peer support networks better. We need to make them capable of helping patients and caregivers navigate the journey. And Dr. Tanya Lal gave one example as well. And there's I think also one other thing, we really need to demand as a right, the care needs to be respectful and empathetic, right? And to patients as well as the caregivers, because it is a difficult thing. And I think you talked of it, Rizwan ji, that, dignity is important. And the only way patients feel that their dignity is being kind of respected is if the care itself is respectful. And organizations like, finally, I'll just say that organizations like Lung Connect, Patients Engage, we're doing a lot of work, but there's a long way to go. And we can't leave it to chance for people to find us. We need to find better ways of connecting patients at the point of diagnosis to resources that are out there.
Right.
I think
Thank
I'll
you.
stop there for now.
Yeah. Thank you so much for sharing your thoughts. Thank you. My next question is Dr. Sevanti Limay. Dr. Sevanti?
Yes, I'm here.
Yeah. So my question to you is, from your clinical perspective, what systematic changes could help ensure that lung cancer patient in India get faster diagnosis and more personalized treatment? What is your opinion on that, ma'am?
So essentially, I have been quite outspoken about this. We have to ask for testing. Hello?
Yes, you are audible. Yes,
Yeah,
you are
okay.
audible.
So basically, when we have a patient who has come down with pneumonia, or when we have someone at home who has cough, fever, what do they expect to be done when they see a doctor? They expect to go through a chest x-ray, blood test, examination. Similarly, if someone has been diagnosed with cancer, they should expect to undergo a genomic analysis. But this awareness is not there amongst people, not there amongst patients, not there amongst a lot of doctors, even oncologists. And that, as I've been hearing all the patients and patient advocates talk, I think that should be a right of the patient to expect and factor in for additional advanced testing. And cancer should mean additional advanced testing. And why is that so? Because today, globally, 2/3 of all cancers are diagnosed in advanced stage. When we say advanced stage, we mean that the time may be tight. And if you get it right, that same person may end up living much longer and have the best outcomes, least waste of their time, their money, their energy, and the resources of the nation as well. So I think educating and empowering our patients, our doctors, not just in major centers, but everywhere, should be the norm. And the genomic analysis should be incorporated as a main frontline testing for lung cancer patients, at least. And it should be a right. I also heard from several patients as they spoke this evening, and everybody spoke very well, actually. Really inspired by the information sharing and openness of a lot of the patients that spoke this evening. And congratulations to Lung Connect for bringing everybody together. But the other message that I got through what they spoke was regarding funds. So funds always a challenge, insurance always a challenge, and what all a patient has to go through with their diagnosis as they are struggling with juggling their work, their household, their homes. They're also juggling the doctor's office, the long waiting lines, the communication gaps, and the hand holding. And I think one idea that has been introduced through Lung Connect regarding the buddy program is most critical. Anyone who has the bandwidth to be the buddy for a newly diagnosed patient is doing a great service. So I really appeal to anyone who's listening online because I feel a newly diagnosed patient could really benefit hugely and feel much less overwhelmed by being helped by a buddy from the program. So I don't know if I've answered your question, but
Yes, yes,
essentially,
yes, yes, definitely.
it is very important for us to incorporate the right diagnostics in the initial conversation, and for different initiatives to be aware of funding for the diagnostic techniques, because lung cancer is a very heterogeneous disease, and understanding which type of lung cancer may be a game changer for a newly diagnosed patient. It is most critical.
Thank you so much, ma'am, for your inspiring word, and you touched about a lot of things. And yes, I can say that the cancer does not only affect the patient, but in totality, it affects the whole family actually.
Yes.
So thank you so much. My next question is to Mr. Prabhat Sinha. So, uh, Prabhat ji, yes, in your view, how can partnership between government bodies, industries, and patient organizations like Lung Connect India Foundations drive real progress toward equitable and timely cancer care? What is your opinion in that?
रिजवान जी, और कोई दूसरा ऑप्शन ही नहीं है पार्टनरशिप के अलावा. देर इज नो अदर ऑप्शन, राइट? सो एब्सोल्युटली देर इज नो अदर ऑप्शन अदर देन पार्टनरशिप, राइट? बट एंड आपने कहा इक्विटेबल केयर, राइट? इनफैक्ट लंग कनेक्ट पे मेनी टाइम, एंड आई थिंक एवरी टाइम, वेयर एवरीबडी हैज ब्रॉट वन पॉइंट इज दैट एवरीवन डिजर्व्स द सेम. अगर आज हमारे कंट्री में, in terms of access, whether it's access to information, access to diagnosis, as Dr. Sevanti ma'am was saying, access to treatment, access में there should not be inequality. There should be equity. And I think, and ये तभी आएगा जब, and it's not easy. Partnership बोलने में, it looks a very small word, but I think it is very challenging to kind of make partnerships, run partnerships, right? It's not easy. But despite of that, I think Lung Connect in itself, and you need somebody to drive this. कोई एक ऐसा कैटलिस्ट चाहिए जो कि सबको इकट्ठे लाए. एंड अगर आप पिछले कुछ सालों में देखें, लंग कनेक्ट ने वो शुरुआत करी, राइट? एक प्लेटफॉर्म बना, उस प्लेटफॉर्म पे बहुत सारे दूसरे जो एक्टर्स आने लगे. एक्टर्स मीन्स गवर्नमेंट, इंडस्ट्री, क्लिनिशियंस, बहुत सारे लोग आने लगे. तो ये पार्टनरशिप, और जब इकट्ठे आते हैं, एक चीज जो सबको करना है वो पेशेंट्स को सुनना है. हमको बोलना कम है और सुनना है. आज भी आप लोगों ने इतने अच्छे अच्छे पॉइंट्स बोले, अगर उसमें से हर डिस्कशन में दो तीन चीजें ऐसी आती हैं जो कि एग्जीक्यूट करने वाली होती है, तो वो पार्टनरशिप में इंपॉर्टेंट है कि एक तो कोई उसको ड्राइव करे जो सबको इकट्ठा लाए, मौका दे सुनने के लिए. लंग कनेक्ट के थ्रू या और भी ऐसा कोई प्लेटफॉर्म है जहां पे कि पेशेंट्स, केयर गिवर बोल रहे हैं, उनसे सुने, और सबके लिए विन विन है. कोई कंपनी दवा बना के यही चाहेगी कि वो दवा ज्यादा से ज्यादा लोगों तक पहुंचे. अगर 10-15 साल उस दवा के रिसर्च में लगा, इतने सारे लोग उससे जुड़े लगे, उसका विन क्या है? विन है कि ज्यादा से ज्यादा लोग उसका यूज करें. सरकार भी दिल से यही चाहती है कि भाई वो जो ट्रीटमेंट है वो सबको पहुंचे. लेकिन बहुत सारे चैलेंजेस एक्सेस रिलेटेड जो हम अभी यहाँ पे सब बात नहीं कर पाएंगे, लेकिन वो मिड पॉइंट पहुंचेगा जब लोग इकट्ठे बैठेंगे, बात करेंगे, चीज पॉइंट ए से पॉइंट बी तक जाएगी. ठीक है? और वो एक जर्नी है. अभी एक दिन में सोल्यूशन नहीं आएगा, बट आज से 5 साल पहले हम कहाँ थे और आज कहाँ हैं, उसमें फर्क आया है, और अगले 5 साल में भी फर्क आएगा. लेकिन वो बात वही है कि राइट डिलेड इज अ राइट डिनाइड. तो अगर हम मेहनत करेंगे, इकट्ठे आएंगे, तो वो जर्नी शायद हमारा जो अगला पड़ाव है वो थोड़ा जल्दी आएगा, राइट? और उस जल्दी आने में कुछ जानें बचेंगी, किसी का क्वालिटी ऑफ लाइफ बेटर होगा. सो आई थिंक इसीलिए अगेन ये चॉइस ही नहीं है. पार्टनरशिप जरूरी है, ये चॉइस नहीं है, ये मस्ट है, और ये होना है, और बहुत स्ट्रांगली होना है. दैट्स ऑल.
Yes, thank you, Prabhat ji, for your words. Moving next, Shampa Ghosh. Shampa. यस। सो आपका सवाल ये है कि जो लोग अभी अभी लंग कैंसर का सामना कर रहे हैं, न्यूली डायग्नोस हैं, जिनको अभी भी लंग कैंसर हुआ है, आप अगर जो लोग सुन रहे हैं या हमारे पास ये रिकॉर्डेड सेशन है, आप उन्हें क्या सलाह देना चाहेंगी ताकि वो अपने इलाज में एक सक्रिय भूमिका निभा सकें?
हाँ, देखिए, कैंसर का जो इलाज है वो बहुत महंगा है। वो बहुत ही फाइनेंशियल में बहुत ही इफेक्ट फैलता है। और यहाँ पे मुझे लगता है कि इन माय एक्सपीरियंस कि डॉक्टर को सब बताना चाहिए, सब कुछ खुल के, ताकि डॉक्टर कुछ कर सके, बा कोई तुम्हें सलाह दे सके कि ये करो, अ, यहाँ जाओ, वा किसी से हेल्प मिलेगा तुम्हें। क्योंकि ये जो ट्रीटमेंट है वो लॉन्ग टाइम ट्रीटमेंट है। वहाँ पे रहता है, बहुत दिन रहना पड़ता है, और ट्रीटमेंट भी लॉन्ग टाइम है। तो ऐसा लगता है कि तुम्हारा जो कोई भी एक पेशेंट का जो भी सवाल है वो खुलकर बताना चाहिए डॉक्टर को, ताकि वो तुम्हें कोई सलाह दे सके।
करेक्ट, करेक्ट, बिल्कुल सही बात आपने कहा कि जो भी आपकी इश्यूज हैं, चाहे फाइनेंशियल हो, चाहे अफोर्डेबिलिटी हो, चाहे आपके कन्वीनियंस का इशू हो, बिल्कुल आप खुल के अपने डॉक्टर से बात करें। डॉक्टर
हाँ,
आपको सही
मेरे
सलाह देंगे।
एक्सपीरियंस में ऐसा लगता है कि कैंसर इतना डरावना नहीं है, उनका ट्रीटमेंट ही डरावना है। वो बहुत
राइट, राइट।
ऐसा लगता है।
थैंक यू, थैंक यू, थैंक यू शंपा, अपनी बात रखने के लिए। थैंक यू सो मच। यस, माय नेक्स्ट क्वेश्चन इज डॉक्टर अमित कुमार। डॉक्टर अमित,
Yeah.
yeah, my question to you, sir, ke, how can doctor ensure that patient truly understand their treatment options, their side effects, and their outcome beyond just signing the consent form? What is your opinion on that?
So basically, it's most important कि we have to explain them in their own language. कि
Yes.
पेशेंट्स की जो डिजीज है उन्हीं के भाषा में उन्हें समझाने की बहुत ज़रूरत होती है। एंड एज डॉक्टर सेवंती ने कहा कि वो एवरीथिंग ऑन द फर्स्ट विजिट इज द मोस्ट इम्पॉर्टेंट। कि जो प्रॉब्लम लोगों को होता है कि 10 या 15 मिनट का कंसल्टेशन, आई से द फर्स्ट कंसल्टेशन कभी भी इतना कम नहीं होता है। जनरली फर्स्ट टाइम जब पेशेंट आता है तो वी हैव टू एक्सप्लेन कि पेशेंट को कि एग्जैक्ट उनकी डिजीज क्या है, एंड वेदर इट इज ऑन अ बोर्ड और अ पेपर और अ पेंसिल। सो हम तो पेपर और पेंसिल लेते हैं, एक्सप्लेन कि आपका ये ऑर्गन है, ये ऑर्गन ऐसा दिखता है, इसमें इस तरह की तकलीफ हुई है और इस तरह की बीमारी आपको हो रही है, और फर्दर जब ये बीमारी है तो इसका इलाज कैसे होगा, हाउ यू आर गोइंग टू बी ट्रीटेड, एंड फर्दर उसके इलाज के लिए क्या जांच कराने की जरूरत है, क्या एकदम मस्ट है दैट हैज टू बी डन, कि इनिशियली आपका बेसिक मिनिमम है जिससे आपका ट्रीटमेंट स्टार्ट किया जा सकता है, एंड व्हाट की वी कैन, कि अगर आप अफोर्ड कर सकते हैं तो हम और अच्छा क्या कर सकते हैं, और क्या स्टैंडर्ड है, एंड हाउ टू अरेंज द फंड्स ऑल्सो। तो बेसिकली हमारे पास कभी भी कोई पेशेंट आता है तो आफ्टर एक्सप्लेनिंग कि ये आपकी बीमारी है, ये इस स्टेज पे है, ये इसका नेचर ये है, आउटकम्स जनरली इट ऑल डिपेंड्स, कि हम पेशेंट को आउटकम भी बताते हैं बट इट डिपेंड्स कि पेशेंट का मेंटल स्टेटस कैसा होता है। तो दिस पार्ट वी कैन स्किप, कि हम 2 या 3 सेशन या 4 सेशंस लेते हैं पेशेंट को एग्जैक्ट आउटकम बताने में, क्योंकि कभी कभी जब स्टार्टिंग डायग्नोस होता है तो एवरीबडी इज अफ्रेड, हर कोई डरा हुआ होता है, और पहले दिन ही अगर हम सब कुछ बताया जाए तो वो शायद टॉलरेट करना मुश्किल भी होता है। और कभी कभी कुछ लोग वी हैव सीन, मतलब जो पढ़े लिखे होते हैं तो फिर भी कर लेते हैं, बट गांव के एक ऐसे पेशेंट्स भी आते हैं जिनको अगर पता है कि ये बीमारी है तो जैसे कि अब कुछ भी नहीं हो सकता है। हाँ, एंड अगर वो आ जाए और हमें आउटकम भी बोले तो फिर कहेंगे कोई मतलब भी नहीं है कि हम इसका इलाज भी करें, वी जस्ट गो बैक। तो उस तरह की भी चीजें नहीं आनी चाहिए, कि हमें एग्जैक्टली क्योंकि जो ट्रीटमेंट होता है इट ऑल डिपेंड्स। कभी कभी हमें ये भी लगता है कि कोई एज भी बहुत सारा इंपॉर्टेंट हो जाता है, कि कभी ये एज अगर 60-70s में है तो उसे हम नॉर्मल मानते हैं और उसमें कोई भी ट्रीटमेंट वर्क्स गुड, पेशेंट को भी बहुत परेशानी नहीं होती है। बट जैसे शंपा है या और पेशेंट्स हैं जो अर्ली एज में होते हैं, हाँ उनके साथ ये होता है तो इट्स वेरी ट्रबलसम। तो एवरीथिंग हैज टू बी एक्सप्लेन, बट उनमें होता है कि हमें अच्छे से एक्सप्लेन करना है, बताना है कि क्या फर्दर ट्रीटमेंट है, एंड फर्दर द कॉस्ट, कि कॉस्ट भी हम उसको किस तरह से देख रहे हैं, और कि आपको डे वन पे कितना खर्च हो रहा है एंड कैसे फंड्स अरेंज करने होते हैं। तो देयर आर मल्टीपल, अब ये इंडिया में हम कहें कि फंड्स टफ है, जरूर टफ है, बट अरेंज होता है। एंड लंग कनेक्ट के थ्रू यह हमें पता है कि चाहे हम मेडिसिन फ्री अरेंज करा सकते हैं, चाहे हम टेस्ट फ्री अरेंज करा सकते हैं। तो आज की डेट में लंग कैंसर में ऐसा कुछ भी नहीं है, आप चाहो एमजीएस या जेनेटिक टेस्ट यू कैन गेट इट डन फ्री। मेडिसिन मोस्टली अब फ्री हो गए हैं, पहले कुछ मेडिसिन में चैलेंजेस थे, एल्क में चैलेंजेस था, बट वो भी फ्री, एवरीथिंग कैन बी डन। बट है कि आपको सही नेविगेशन और सही चीजें पेशेंट को बतानी होती है, एवरी टाइम इट हैज टू बी एक्सप्लेन। हाँ, ये एक्सप्लेनेशन ये हम कह सकते हैं कि हर विजिट में फिजिबल नहीं होता है, बट फर्स्ट विजिट डेफिनेटली। इसके बाद जब हम स्कैन 3 महीने में या 4 महीने पे पेशेंट को दोबारा देखते हैं, अगेन एक डिटेल डिस्कशन होना चाहिए, एंड इट इज द राइट ऑफ द पेशेंट ऐसे कि आपको उस समय पता होना चाहिए कि हाँ ये आपकी बीमारी थी, अब यहाँ से यहाँ तक पहुंच गई है, आगे अब आगे क्या करना है। तो ये एक्सप्लेनेशन पेशेंट्स को बताना बहुत जरूरी है, और
Right, right.
अवेयरनेस पेशेंट में भी बहुत होना चाहिए, उनको पता होना चाहिए, ये नहीं कि हम बस इलाज करा रहे हैं, दे शुड नो कि हमारी बीमारी ये है, हमें समझना है कि हम आगे कैसे जा रहे हैं।
Right, right. Thank you so much, sir. Thank you so much for explaining this topic. Now, moving next, Mr. Rishi Maheshwari. As in your first talk, you have already mentioned a lot of things. So, if anything more can be done to increase awareness and ensure better implementation of patient rights in hospital, clinics, and healthcare system, anything more can be done. What is your opinion in that, Rishi?
Sure, Rizwanji. I'm thankful again for asking me this question. The first important part, which I gathered from all the conversation today, and thanks so much for others giving this opportunity for us to hear, is a right to information. Dr. Amit very rightly mentioned that when he's been visited and asked for a second opinion, he very candidly says that this is a specialist. Why don't you go to him for this specialization? Why don't we have a forum of this kind? It will take about 5 to 7 minutes for each doctor to do that every day. It is not that a doctor is giving away its own business to somebody else, but it's just helping a patient like us who have perhaps identified the issue but doesn't still know that which doctor to visit. It is very important for us to be able to pinpoint to a doctor, because that information can only come from fellow doctors, and we'll have faith in that system if in case it comes across. It's a very easy aggregation platform, like most ott platform, like most of the Swiggy and Zomato platforms are, or a review platform is. This is a more authentic, credible platform where a patient find that once the doctor has prescribed another doctor for a specialization, I think this is a better way to go versus today when you're just looking at Google and trying to figure out where to go. I think, right, all the other things are an initiative which takes a larger effort, but this is the one which can actually take much easier effort from the part of, the doctors themselves. I would thank the doctors today, Dr. Amit and Dr. Limaya. I think they should appear in more open forums like these. Lung Connect has done enough to get more such doctors. I think you should encourage more doctors to come over there. It feels like doctors are one of our own. You won't believe, but when you go into a doctor's chamber, you go with a lot of preparation to be able to know, to be able to face themselves, to be able to face them, face your own queries and answers to those queries, whether you're able to remember those answers succinctly or not. Now, for this, may I request that I have done that earlier and I was rejected doing so. That can I record a conversation when I am with a doctor? I have asked 10 questions, but in a sequence, I am not a doctor. I'm a patient, or I may be a caregiver. In the sequence of asking those questions, you may have explained and done your best to explain it, but I may not be able to register all of it. It is extremely difficult for me to get back to you and be able to ask that same question again, or be able to go to any other doctor and get the same answer again. But if I get a recording of a sound recording, I'll be able to understand it, get in my head again and again. I think most doctors right now do not like it, but believe me, for a patient, it's a life-saving opportunity. The third part is about the insurance. I would tend the government to actually fill in the shoes. I have been taking immunotherapy drug pembrolizumab for the last 5 years. There is not enough evidence for how long one should take this. I think the government should step in and believe that either they should subsidize this medicine. Secondly, there should be enough evidence of Indian medicine practitioners or generic medicine or specialized medicine practitioners who should be able to tell me this, or other doctors on a similar forum who should be able to tell me this, that कि मुझे कितने समय तक ये medicine लेनी है. today the doctors do not have a clear answer to this, because clearly this is a more advanced or a more recent medicine. लेकिन इस तरह के कई सारे सवाल जो मुझे जिसके आंसर नहीं मिल सकते हैं, नहीं मिले आज तक, मैंने 4-5 साल से ढूंढ रहा हूँ, शायद आप इस फोरम और इन डॉक्टर्स के थ्रू ये चीज को इनिशिएट कर पाएंगे. थैंक यू.
Thank you. Thank you so much. Thank you so much, Rishi. You have put a lot of questions, a lot of things need to be done regarding patient rights. My next question is with Dr. Tanya Lal. My question is, what message you want to convey for caregivers specifically regarding the patient's right? Your opinion in that?
Okay, yes, sir. So, once when a person is diagnosed, don't go with there's a, I'll quote what patients I've heard from everybody is, अब मुझे ये disease हो गया है तो अब मुझे hospital के धक्के खाने पड़ेंगे. Don't go with that mindset. However, to some percentage, the patient is not wrong. So, you consult the doctor. Don't be afraid to ask any questions. Don't hesitate. And like Rishi ji said, that there are so many things which we forget. What I do, or what my relatives do, or what my mother does is we sit with a pen and a pencil, a notebook. And I have shared this before also, before going to the doctor, because I know if I have traveled 2000 kilometers, or if I have spent hours in waiting, I just have those 10-15 minutes with the doctor. I note down the questions. So we sit one day prior, me, my parents, and we all sit, ki doctor se kya kya puchna hai. So we sit down, we write those questions. So don't be afraid or don't hesitate to ask the questions. Ask. I think just like Amit sir also said, that there are many doctors who explain what is the disease, and they particularly draw the organ system. So you need to understand the disease. So make sure that you understand what you have been diagnosed with. Do discuss what are the treatment options that are available. And again, I would highly highlight, do not be afraid to take a second opinion or a third, or till you feel that you have gone to the right place. Also, there's one question which I feel all should be encouraged to ask to the doctors is, are there any clinical trials available for this disease in a country? That is one thing. And also, do not be afraid to ask about financial aid. If you are traveling, what about the transportation, and what about the residential, other things that are involved? Then I have few suggestions, or maybe few things that the healthcare system needs to do, is which we've been discussed right now, is right to dignified care, better care system, and better insurance policies, access to the procurement of the medicines, and information, and its affordability. I think maybe the entire healthcare system, which involves us, which involves the doctors, patients, caregivers, eventually, when they come out of a visit, they should come with the satisfaction, nahi, aaj hame theek laga doctor se baat karke, because the way the doctor interacts with the patients, half of the treatment is done there. That's what I feel, because we need that spirit to, we need that encouragement to go to the doctors every single time. And my mother, because of the care, the sort of care that we have received in different places that we go to, she looks forward for her appointments. So I would request the caregivers to please not to be afraid. Do not hesitate. Even if you forget, please take permission and come back again. Ki sir, hum ye पूछना भूल गए. So come back again and ask. And I also request the healthcare system to kindly, after this discussion, maybe we could just note down points, and we need hardcore solutions for certain issues. Once again, I thank you so much for having me here on this platform.
Thank you. Thank you so much, Dr. Tanya. And with that note, I would like to thank all our panelists for sharing such a meaningful and inspiring insights. So today's discussion reminds us that patients' rights are not just the legal definition. They are about respect, empathy, and empowerment. So when patient, caregiver, doctor, policymaker, and advocates work together, we move closer to a healthcare system that truly listen and cares. So on behalf of Lung Connect India Foundation, I extend heartful gratitude to all our speakers and participants for joining us during Lung Cancer Awareness Month. So let's continue to stand together